Okay, Chris and I are here to show you guys a demonstration of how to insert a radial Artline on an adult patient. Before you ever do an invasive procedure, you always want to check for your physician orders first. So after you've checked orders, you're going to look through the patient chart and you're going to be checking for contraindications to the procedure. For Artline insertion, contraindications would be coagulopathies. You're going to want to look at their lab values for their clotting times and make sure they're within safe limits. And you also need to perform your modified Allen's test and ensure that you have a positive modified Allen's test. Go ahead.
It's also very important that you explain the procedure to your patient. In this case, our patient is sedated and unconscious and ventilated at the present time. However, you still want to explain the procedure to your patient. You also need to obtain consent. In this case, we have implied consent because we're in the ICU. Otherwise, obtain consent from your patient.
Before we start setting up the equipment for the insertion procedure, we'll have Chris go through the equipment you need for your pressure transducing system.
So, one of the first things you're going to need is you're going to need your bag of heparin solution. So we're using 1 unit per mil of heparin solution. In this case, we've made up the bag of heparin solution. Oftentimes in the hospital you'll find the bags of pre-mixed heparin solution. Important to note that if you do make up the bag of heparin solution, you are going to want to label that so that everyone knows there is a medication added to the bag. You're also going to have your transducer system. So you're going to flush the heparin solution through the transducer system, ensuring that there is no air left in the line at the time when you're done. You'll also change the white caps on the system to the blue cap so that there's no air possible to enter the system. There's also some little labels that you can throw onto the system so that people know that it's an arterial line. You'd want to use the red dots. And finally, you're going to add the pressure bag to the system. So you're going to inflate the pressure bag to 300 millimeters of mercury to ensure that you've got pressure on the system and you won't get backflow into the transducing system. Alright, so now we have our fully set up transducing system. So we've flushed the whole line, we've made sure that there's no air in the line, and we've made sure that all our stopcocks are in the off position. Okay. We've also added the label so that we know that this is an arterial line, and we've got a pressure bag inflated to 300 millimeters of mercury. So this has been leveled with the phlebostatic axis on the patient, and we have zeroed the system.
The rest of the supplies we have on the table over here. Before you go to set up for the procedure, if you have long hair, you want to make sure to put it back so it's not falling in your face or into your sterile field as you're working. Wash your hands. And then, looking at the equipment that I've got laid out, I'll just explain it first, and then we'll show you how to set it up after. Because it is a sterile procedure, we're going to be using a sterile gown, a mask, goggles, and sterile gloves for it. So you become a sterile person. We need the sterile drapes. They're also called huck towels sometimes. We have some extra gauze, the Providine antiseptic or any suitable antiseptic, and some sort of sterile basin with tweezers or forceps or something that allows you to clean the site. This particular dressing tray comes with sterile drapes, some sterile gauze in there, and tweezers and some other extra equipment that you don't need. But it gives us a place to put the antiseptic and the sterile gauze and tweezers to do the cleaning. You want to have a couple Artline kits in the event that you're unsuccessful the first time. We're using the Arrow all-in-one radial Artline kit, so this has the integral guide wire and catheter over the needle in here. You will need a transparent dressing and some tape in order to secure the catheter after insertion, and your assistant will be helping you with that. And then as far as freezing goes, you can freeze as a sterile procedure or as a clean procedure. If you're doing it as a sterile procedure, you're going to be using the syringe and the needle opened up onto your sterile field. If you're doing it as a clean procedure, we'll show you that as well. You're still going to need the same 3cc syringe, 25 gauge needle for the freezing, alcohol to clean the site, and gauze to hold the site after. And of course your 2% lidocaine. So now we're going to show you how to do the freezing of the site as a clean procedure. Again, we've already done the modified Allen's test on our patient, and Chris is just putting a blue pad underneath the arm here, so in the event we get any blood spatter or anything, that it protects the bed sheets so we don't have to change those. So to do this as a clean procedure, using gauze, you want to start at the inside of the site and work outwards in ever widening circles. And then let that dry naturally, so no blowing or waving your hand or anything like that. The rest of the supplies you need, you want your gauze set near the site, so once you remove the needle, that it's easily accessible. And now for these multi-dose lidocaine jars. When you first open these, they're going to have a sterile top on there, and it's sterile initially, but after it's been used once, you're going to want to make sure to fully clean the surface of this in order to maintain the sterility of the fluid inside. Now you've got your 3cc syringe and a 25 gauge needle here. So you want to put those together, again maintaining sterility of the connections. Now to use these multi-use vials, it's recommended to inject the air into the vial of the volume of the solution that you're going to remove. So we only need to use about a cc of lidocaine during the freezing procedure, but we end up usually taking a little bit more just to give us a buffer there. Okay, and you can set that aside. So our site has been cleaned and dried. You can always alcohol your fingers again. You're going to palpate the artery, and because we're going to be inserting the Artline in this area, we want the freezing to take effect around the whole area. So palpating the artery, we're going to just insert the needle near the artery but not directly at it. And it's mostly superficial. So insert the needle, you're going to withdraw and confirm that no blood is coming back, and then you can actually inject the lidocaine, about 1/3 of a cc at once. I'm not going to inject it into our arm right now. After injecting it, you're going to withdraw just to the bevel and do a redirect. And then draw back on the syringe, confirm that there's no blood, and then again you could inject some lidocaine. So this is usually done in 2 or 3 different areas in order to make sure the whole site is frozen. So make sure there's no blood, and then again I can withdraw. And if I could get my assistant to help me with my sharps container. You gotta always remember to put your sharps in the sharps container as soon as possible to protect everybody. So this will take about 5 minutes to take effect, and during that time you could set up your sterile field. We will show you how to do the freezing as a sterile procedure as well. So we're prepping for setting up our sterile field here. It's important to remember sterile fields, you have to be very conscious of them and that you're not brushing up against them or rubbing the edge of your shirt or something into the sterile field. What I prefer to do is using the sterile drapes. As you open this package, it allows you to create a sterile field because the inside of this packaging is still maintained sterile. So you want to open it without touching the inside. And then that creates a nice sterile field for you. So again, you're being very conscious of this. You're going to open up equipment onto your sterile field that you're going to be using, so the Radial Artline kit. And I'm just going to open up one of them. If I needed another, you do have an assistant for this procedure who could always open it. So you're going to dump it onto the sterile field, again taking care not to touch it. The dressing tray that we're going to use is not sterile on the outside, so I can't place this onto my sterile field or I would contaminate it. So this dressing tray, again, I'll just open up, and the basin, because it's underneath those sterile drapes that are there, I have to get my assistant to fill it once I'm sterile myself and able to move those drapes out of the way. I'm going to show you the freezing as a sterile procedure as well. So you need to open up the 3cc syringe. And your needle onto your sterile field. Your assistant's going to help with the lidocaine, so you need the lidocaine and the alcohol to clean the top of it ready as well. Now as far as extra items, we usually throw a few extra pieces of gauze onto the sterile field, and this is because in the event you're unsuccessful, because you've just been poking around near the patient's artery, you're still going to need to apply pressure before you make a second attempt. So just have a few extra pieces of the sterile gauze there. So once my sterile field's ready, again I'm going to just move it out of the way as I gown up for this procedure. Gowning for a sterile procedure is different than gowning for isolation. So we're going to first start with a mask. and your goggles. I am going to take the mask off just for the video so that you can hear my voice a little more clearly. Now I have my sterile gown and gloves. The gloves you need to get ready prior to putting the gown on. So same as the sterile field, as long as I am not touching the inside of the gloves, I'm not contaminating them. So you can open these up and have them ready and still maintain sterility. The sterile gown, you'll often see in the hospitals that they're using disposable gowns. So it just comes in a plastic wrapper and they are thrown away when you're done with them. This is a reusable one. Any gown that's going to be used as a sterile gown will be packaged that lets you put on the gown without touching the front side. So right here is the inside of the gown. And usually I reach in and pick up the gown like this. And again, you want to check your surroundings to make sure you don't brush up against anything. And then you need your assistant to help.
Okay, and you're going to notice that I'm going to try where I can to touch the inside of the gown, not the outside. We're going to do this up so that as Jen's doing the procedure, she's not having the gown fall down around her shoulders, limiting her movement. There you go.
Thank you. Now the sterile gloves, it takes a bit of practice to get used to putting these on. The cuffs are folded up, so the inside of the gloves are considered not sterile, and the outside are considered sterile. So I can touch the inside part of the glove here in order to get my right hand on. And then you fold up over there. And then I'm going to use my sterile glove to go, again, just touching the outside surface of this other glove. Okay, and now that your gloves are on, you're going to want to make sure your fingers are snugged up. You don't want to have these big ends on your fingers as you're palpating the artery and trying to insert the needle nail there. So make sure your gloves are fitting well. Great. So now I'm sterile. I'm going to get Chris to assist me with putting the antiseptic into my basin.
So notice I don't step over the field.
Okay. So using the tweezers, I'm going to use gauze to clean the patient's site. So this goes a little bit beyond just what our alcohol swabs does and really disinfects the site completely. And again, I'm starting in the center and using firm motion, clean in an ever-widening circle, and we go quite wide on this to clean an area much larger than I need. And then that way my sterile drapes that I put down will cover that. This is garbage, so just set it aside and get another piece of gauze. And again, you can keep cleaning the site to make sure it's extremely well disinfected. Now you may see different procedures done here. They may not be so thorough in cleaning the site. It really depends on how long that Artline is going to be inserted. So for instance, in the OR, they often use a modified procedure with more just alcohol swabs and a more not as sterile as this. But a patient who's going to have an Artline left in place for a long time, you're going to be diligent on making sure that you have a very clean site so they don't get an infection. Now, I can rearrange my sterile field here. These sterile drapes are used to kind of protect the area around our sterile site and help prevent you from contaminating them. You need to be conscious of your fingers when you're doing this, that you don't touch. So you're going to place the drape and then drop it when it's in place. So now I have good access to palpate that artery, and I've thoroughly cleaned that whole area, so I shouldn't have very minimal risk of contaminating there. Now we're going to show you how to freeze the site as if this were freezing done as a sterile field. So pretending we haven't frozen already. Yeah, just connect your needle to your syringe here, and this is where your assistant comes in. And you need good teamwork for this. So Chris is making sure that that lidocaine top is clean for me. I'm withdrawing the air into my syringe. and withdrawing the lidocaine that I need for the procedure. Okay. So again, same procedure before as here, palpating the artery, and fairly superficial. You're just going to go in, withdraw, make sure there's no blood, and then you would insert about half or a quarter to third of a cc of the lidocaine at a time. You come out to the bevel, change direction, and then advance. Again, you're always confirming that no blood comes back. And you can see there I've drawn back a bit of blood. That's indicating I'm in a vessel, and you wouldn't want to inject the lidocaine right into the bloodstream. So in that case, you pull back out to the bevel, change direction again, and then withdraw, make sure there's no blood, and then inject your lidocaine. Okay, so we're using the all-in-one Aero Radial Artline kit. So you want to check for function. You need to remove the cap. You want to ensure that this catheter moves freely off of the needle, that the bevel is up, it's indicated by a little notch in the plastic here, and that your guide wire moves freely through the system. Make sure the end of the needle has no burrs or malformation on there. This black line is indicating where that guide wire exits the tip of this needle. So basically the importance of this is as you're doing the insertion procedure on the patient and you get a flash of blood, when you go to advance that guide wire, if it stops here due to resistance, that's telling you you're not into the patient's artery. It's often caught just on the edge of the artery and you haven't fully gone in, or perhaps you've gone through it. In that case, you need to pull back on the guide wire and do a full redirect. So bring this back out to the surface, to the bevel, change a little bit, advance, and start over until you get your guide wire sliding smoothly through. So our patient, his arm has been frozen, and we want to ensure we wait the full 5 minutes to get good effect there. Again, palpating the artery, and take your time doing this. You want to be fairly certain of the path of that artery and where you're going to be threading this catheter in. So feeling the artery, little poke, Mr. Jones. Once you get this flash of blood, the guide wire should go nice and smooth like that. Again, if you hit resistance here, withdraw the guide wire and do a redirect. Now you're going to thread this catheter in until all the narrow portion of the catheter is into the arm. Now I'm going to apply a bit of pressure with my fingers here to prevent the blood shooting out over here. And now I'm going to take my transducer from my partner, and notice my right hand has just become non-sterile. My left is still considered sterile at this point. So now that I've connected this, the first thing I want to do is have a look up at my waveform. And again, we are simulating this, so we aren't seeing a perfect arterial waveform, but you would see, or you should be seeing a nice arterial waveform with a dichrotic notch in there. And noting the blood pressure numbers, they should be similar to the last non-invasive measurement of the patient. After you've confirmed the waveform, again, you want to look at your site, make sure there's no hematoma development, or anything abnormal there at this point. So now we can secure this site. Both hands have now become non-sterile, so I don't want to be touching that insertion site anymore. Most people loop for radial Artline, they loop this tubing around the thumb. And now I'm going to keep a little bit of gentle pressure, making sure that catheter stays inserted in the arm. And my partner is going to hand me a sterile dressing. When placing the sterile dressing, you want to be sure to just cover the catheter and not the full connection, because they'll oftentimes change out the tubing for fresh tubings and leave the same Artline in place. These transparent dressings stick extremely well on real skin and not quite as well on our mannequin. So these dressings are nice because I can still visualize the site. I'm confirming there's no bleeding, no hematoma, and it prevents infections from getting in. Now the rest of the tubing still needs to be secured. So using tape, you will just secure it to the arm until you're satisfied that that is a fairly secure site. Okay, so again, I'm happy with my waveform, and I'm happy with the numbers. What I want to do is, again, just confirm that I have no bruising or bleeding at the site. Check your perfusion distally, so looking at your fingers, make sure you still have good perfusion in those fingers. And then you want to come back to your sterile field. The person who was doing the insertion procedure for any invasive procedure is responsible for cleaning up their sterile field, which means all the sharps are solely their responsibility. Oftentimes, An assistant will take over clinically and finish the cleanup procedure, but it's still that person's responsibility to make sure every sharp is accounted for. After this, you can clean up, put away all your equipment, and then you're going to go chart your procedure. In Mr. Jones's case, we would chart that we've inserted a left radial art line on the first attempt following a positive modified Allen's. We had no complications, good distal perfusion, and a good pressure waveform on our monitor.